Hello everyone. Today we will learn regarding continuous portion of arthrology. In last lecture we have seen that definition of joint and its classification according to structure, function, region and according to articulating bones. In that we have studied detail regarding classification according to function, that is synoarthrosis, amphiarthrosis and diarthrosis. Synoarthrosis, that is immovable joint, amphiarthrosis, that is slightly movable, and diarthrosis, that is freely movable joint. Okay, today we will learn regarding structural classification of joint, that is fibrous, cartilaginous and synovial joint. First, fibrous joint. In fibrous joints, the bones are joined by fibrous tissue. These joints are either immovable or permit slight degree of movement. This can be grouped in the following three subtypes: suture, syndesmosis and gomphosis. Subtype of sutures is a subtype of fibrous cartilaginous joint. These are peculiar to skull and are immovable. According to shape of bony margins, the sutures can be classified into plain, serrated, squamous, denticulate and syndesmosis. In plain suture, example is internasal suture. Serrate, example interparietal suture. Squamous, example temporoparietal suture. Denticulate, example lambdoid suture. Syndesmosis, example between rostrum of sphenoid and upper border of vomer. Okay, this diagram shows the different types of the sutures: serrate suture, lambdoid suture, denticulate, squamous suture between the temporal and parietal bone, syndesmosis, wedge and groove suture, ala of vomer and rostrum of sphenoid, tibiofibular syndesmosis, and last one peg and socket joint, that is gomphosis. Okay, again same diagram: plain, serrate, squamous and denticulate. Okay, neonatal skull reveals fontanelles which are temporary in nature. At 6 specific points on the sutures in newborn skull are membrane filled gaps called the fontanelles. These allow the underlying brain to increase in size. Okay, anterior fontanelle is used to judge the hydration of the infant. All these fontanelle become born by 18 months of infant. Okay, this diagram show anterior fontanelle, posterior fontanelle. Syndesmosis. The bones are connected by the interosseous ligament. Example, inferior tibiofibular ligament. Bones are connected by interosseous ligament. Inferior tibiofibular ligament. Inferior transverse tibiofibular ligament. Now, gomphosis, peg and socket joint. Example, root of tooth is in its bony socket. Okay, you can see in this diagram peg and socket joint between tooth and its socket, crown of tooth, gum, gingiva, root of tooth, periodontal ligament, alveolar bone. Cartilaginous joints. In this type of the joints, the bones are joined by cartilage. These are of following two types: primary cartilaginous joints. The bones are united by plate of hyaline cartilage so that the joint is immovable and strong. These joints are temporary in nature because after certain age the cartilaginous plate is replaced by bone. It is termed as synestosis. Example, joint between epiphysis and diaphysis of growing long bone. Okay, in this diagram you can see epiphysis, epiphyseal plate and diaphysis. Okay, other examples are spheno-occipital joint, first condo-sternal, costo-chondral joints. Okay, now secondary cartilaginous joints, symphysis or fibrocartilaginous joints. The articular surface are covered by a thin layer of hyaline cartilage and united by a disc of fibrocartilage. These joints are permanent and persist throughout life. Typically, the secondary cartilaginous joints occur in the median plane of the body and permit limited movements due to compressible pad of fibrocartilage such as in the pubis, symphysis and mandibulosternal joints. Okay. Examples: symphysis pubis, mandibulosternal joint, intervertebral disc. Okay, intervertebral joints between the vertebra bodies. Yesterday that we have seen, there was a pad and it acts as a shock absorber. Classification of synovial joints and their movements. Okay, type of joint: plane or gliding movement, gliding movement. Uniaxial joint, hinge joint, its movement will be flexion and extension. Pivot joint, rotation only. Biaxial joint, condylar joint and limited rotation, flexion and extension. Ellipsoid joint, movements are flexion, extension, abduction, adduction and circumduction. Multi-axial joints, saddle joint, movements are flexion, extension, abduction, adduction and conjunct rotation. Ball and socket, flexion and extension, abduction, adduction, circumduction and rotation movement. Okay, in last lecture we will discuss regarding detail about classification of synovial joint. Okay.